Neurology Lounge podcast, a broadcast that aims to explore the intriguing history and the perplexing disorders of the brain. This maiden episode is titled Heritage in Quest of Neurology's Ancestors. But before we dig into the nitty-gritty of things, let me start by introducing myself and my background and setting out my aspiration for this series of podcasts. I'm Ibrahim Imam, a Nigerian and British trained neurologist, and just one of many inheritors of the time-honored tradition of studying the brain and of easing the burdens of those afflicted with its disorders. Over the last 10 years, I have complemented my clinical neurological practice in quite a number of ways. The first is as a curator of a neurology knowledge database called NeuroChecklist. Second was as a blogger on the Neurology Lounge blog, which is the precursor to this podcast. Third, as a book reviewer on the Doctor's Bookshelf blog. And fourth, but not least, as a patient safety and human factors advocate on the blog called Shortcuts and Pitfalls. As a fallout of these itinerant activities, I was also lucky to publish two books. The first is titled 700 Essential Neurology Checklist, and the second, Surfing the Brain. And I have a book on patient safety and human factors coming out shortly. After these vagrant excursions, my intention was to put my feet up and take a big breather. But that was not to be. I was nudged and badgered into changing my mind. I was advised, or was that instructed, to explore podcasting to get my message across to a wider audience. Podcasting has emerged as a popular transmission medium because of its ease, its directness, and its more human touch, qualities which I either lack or try to avoid. Personally, I think people need to read a bit more, but I guess I'm too old-fashioned. But luckily, I'm not too fixed in my ways. So after a lot of foot dragging, I decided to take the podcasting plunge. My aim is to use podcasting as a means of painting a comprehensive portrait of neurology, and to do this using a mix of hard facts and soft anecdotes. The series will delve into the various neurological disorders, but rather than didactic lectures from the podium, I will be exploring the diseases from various angles. As I review the clinical features, the investigations, and the treatments of the various neurological disorders, I will be focusing a lot on the patient perspectives of their diseases. Therefore, expect loads of patient memoirs and anecdotes, as well as interviews with neurological patients who have written about their illnesses and how they took their illness journeys. I will, however, also be speaking to neurologists and neuroscience experts, as well as science journalists who have written accessible general knowledge books about the brain or its dysfunctions. These conversations will evaluate neurologists' knowns and certainties, but also probe into its unknowns and its gray areas. And watch out here for some high-profile names, as well as names which I hope I will make high-profile through the podcast. And expect to hear about popular books, as well as books that I think should be popular. Introductions over, let us go back to the theme of today's podcast, and that is the quest for neurology's ancestors. And this takes us back to around 10,000 BC, when an adventurous Neolithic man, or it could very well have been a woman, we don't know, men tended to write all the books. Anyway, 10 millennia before the birth of Jesus, an intrepid Neolithic person living in either North Africa or the Middle East decided to break into the skull of a living man, or it could have been a woman. Using very primitive tools, he or she succeeded in making a very tidy and circular hole in the skull, and doing so without invading the delicate brain underneath. This suggests that our Neolithic person had a fairly good knowledge of brain anatomy and of how important the brain was. And with this audacious move, this anonymous man or woman introduced to the world the procedure now known as trepanation. This is the surgical creation of a hole in the skull. Although the earliest tools our Neolithic ancestors used for trepanation were crude sharpened flints, their technology gradually evolved to more advanced surgical instruments. The reasons why a Neolithic person undertook this obviously risky venture of drilling into the skull are varied. One reason was probably for spiritual and moral indications. This includes expelling evil spirits and, wait for it, reversing moral degeneration. But trepanation was subsequently carried out to treat legitimate or quasi-legitimate disorders such as madness, idiocy, headache, infantile convulsions, and obviously to extract foreign bodies from the head. You may have wondered, or perhaps not, what Neolithic person did with the piece of skull he or she removed during trepanation. Well, wonder no more. These so-called ancient peoples polished the fragments of skull they took out and wore them as amulets to keep evil spirits away. From the practices today, we're probably not too far away from Neolithic man. But that's a tale for a different podcast. The successful outcome of trepanation, with an enviable survival rate of up to 90%, is a clear indication that it was a sophisticated procedure that the operators carried out using highly developed skills. And these amazing results have been, or they must have been, why the procedure was eventually adopted quite globally. And the most avid inheritors or champions of trepanation after the Neolithic people were the Incas of modern-day Peru. This was where the oldest trepan skull, dating back to between 1400 and 1530 AD, was discovered in the 1830s. This great archaeological find, the Incan trepan skull, is a striking legacy of humankind's enduring drive to heal the diseases of the brain, and it is now safely tucked away in the American Museum of Natural History. But before it found its permanent home, this Incan artifact was first sent to the only person with the authority to examine it at the time, a giant of French neurology called Paul Broca. Who was Paul Broca, and why did he become the go-to man to study such an invaluable object? Well, apart from being one of the foremost neurologists of the 1830s, Paul Broca was also the leading anthropologist of his day. He not only studied countless trepan skulls, he also discovered quite a few himself. Such was Broca's interest in anthropology that he was the person who inaugurated the Society of Anthropology, and this was way back in 1859. Some even believe that Broca founded the field of anthropology itself. Broca even designed many instruments to help him in the extensive measurements he made of the human body, and he focused particularly on the brain. Indeed, a lot of what we know about trepanation today was established by the anthropological studies that Broca carried out in his mission to understand why did ancient man or woman perform trepanation. Whether he discovered it or not, it's not clear, but he benefited from his studies because having looked at the trepan skulls, he was able to perform his craniotomies more efficiently. Craniotomy is the modern name for trepanation. And using craniotomy, he removed things like abscesses from around the brain. So yes, Broca was also a neurosurgeon. Okay, so Broca was a great neurologist, a neurosurgeon, and a pioneering anthropologist. But the reasons he deserves pride of place in this first episode of this podcast is his classical work on localization, that process that dominates almost all neurological encounters and that is driven by the single question: where is the lesion? Neurologists everywhere are compulsive cartographers or map makers who set out first and foremost to identify where in the nervous system a lesion or a disease is located. Without this important information, making a neurological diagnosis is almost impossible. This map-making skill is what has led us to divvy up the brain into its different hemispheres and lobes, and also to understand how each structure in the brain controls different functions of the body. It is also the process that has taught us that, for example, that the occipital lobes control vision, the temporal lobes control hearing and smell, and the frontal lobes control behavior and executive function. It is also how we got to know, mind you, in general terms, the brain is too complex, how we got to know that the cerebellum controls balance, the brainstem controls vegetative functions such as breathing and the heart rate, and the basal ganglia control movements, the thalamus sensation, and the hippocampus memory. Mind you, very little of this was known in Broca's time. That gives us an idea of how big his findings were. Although there were other pioneering brain map makers such as Edward Hitzig, Gustav Fritsch, and David Ferrier, it is mostly to Paul Broca that neurologists attribute the first scientific breakthrough in this field. And he did so with the classical localization studies that have enduringly linked his name with the brain's motor language area, which we now appropriately call Broca's area. Another name for this area is called Area 44, using a brain mapping system developed by Corbinian Brodmann. Brodmann was a German psychiatrist who mapped the cortex, or the surface of the brain, into 48 functional areas. Broca's name is also immortalized by the speech impairment that results when Area 44 is damaged, called Broca's aphasia, obviously. But before going on to see how Broca established where the motor speech area was, let us take a step back to see what preceded him regarding the knowledge of localization. The earliest attempts to localize brain functions was a misguided phenomenon called phrenology. This is the practice of trying to predict people's mental faculties and their personalities by palpating, which is touching and feeling, and by measuring the size, the shape, the contours of people's skulls. If only it was that easy, neurologists would have been out of a job a long time ago. Phrenology was established by a Viennese physician called Franz Joseph Gall, but it was his colleague and mentee called Johann Gaspar Speisheim who spread the practice more widely. Phrenology was very popular in the early 19th century, but thankfully it was eventually knocked off its unscientific pedestal by the efforts of countless scientists. And at the forefront of this anti-phrenology movement was the French neuroscientist and pioneer of experimental brain research called Jean Pierre Flourens. It was only when phrenology was eventually dismantled that scientific localization was able to take off. So an appropriate time to pick up on Broca's story. Broca was a polymath, a master of multiple disciplines. Besides neurology, neurosurgery, and anthropology, Broca was also an expert in oncology, neuroanatomy, genetics, and pathology. And to crown it all, he was also elected as a senator in 1880, a post he used to advocate for public health. But his fame is almost singularly attributed to his study of two people with whom he established the localization of language to the left frontal lobe. The first, and perhaps the most important, was a man called Louis Victor Leborgne. He was a 50-year-old heart form maker who had suffered from epilepsy from his youth and who lost his speaking ability when he was 30 years old. On account of this, he was admitted to the Bicester Hospital, where Broca first encountered him in 1861. At that time, Leborgne was neurologically intact, as we neurologists like to say, apart from his loss of speech. He did, however, respond to questions, and that's to all questions, by uttering the same phrase, tan. And he would do that twice, tan, tan. This is the reason he is more widely known as Tan or patient Tan. Leborgne, however, could become frustrated and angry when others didn't understand him, and in such circumstances he would utter expletives which I'm unable to repeat on this podcast. Over the following years, his right hand progressively weakened and it eventually became totally paralyzed. Worse still, his right leg followed with gradual weakness and paralysis. After his unfortunate death, an autopsy was performed on him and Broca examined his brain. What Broca found was a lesion in the left frontal lobe which showed signs of progression over time. This enabled Broca to link language functions to this area of the brain. So significant is this finding and so important is Leborgne that Leborgne's brain has been preserved in a jar and is now safely tucked away in the Dupuytren Museum in Paris. 7 months after he presented Leborgne's case to the Society of Anthropology of Paris, Broca presented his second patient, this time to the Anatomical Society, also in Paris. This second patient was Lazare Lelong, an 84-year-old man who had suddenly lost consciousness a year before and who, on recovery, was unable to speak apart from uttering 5 words. In a way, he's done 4 more than patient Tan. If you pardon my French, the 5 words were oui, non, toi, toujours, and Lelong. Just like Leborgne, Lelong's brain was examined after his death, and the autopsy revealed a lesion in the same area as Leborgne's was, in the left lateral frontal lobe. That should have been the end of the story. We know where this lesion is, and we know that this is where language is. But countless twists have since emerged in the Broca saga. The first is the controversy that arose over priority for the discovery of the language area. And this controversy revolves around Marc Dax. This is another French neurologist whose son, Gustave, laid a claim of priority on behalf of his father in localizing the speech area. Dax Jr. asserted that Dax Sr., who died in 1837, had submitted a paper documenting 3 cases to the French Academy of Sciences in 1836. This is a good 25 years before Broca's presentations. It's difficult to go into too much detail about this controversy, but suffice it to say it is unresolved. But for most neurologists, it will take more than just a bit of rivalry to challenge Broca's big legacy. The second and perhaps more threatening twist to the Broca story is the modern imaging assessments of Leborgne's and Lelong's brain lesions. These assessments suggest that the area of the brain which Broca argued was critical for speech is actually much larger than that which we now know to be the motor speech area. Understandable, his methods were crude. We have now more sophisticated ways of assessing this. The next stage in the history of localization opened up when it became possible to operate on the brain whilst the patient is awake and responsive. Fans of the Hannibal Lecter stories and films, I'm not one, will know that the brain itself is not sensitive to pain or to any sensation for that matter. This therefore made it possible for anybody to be operated upon while awake and the surgeon fiddling with the brain. One of the pioneers of awake brain surgery was the Canadian-American neurosurgeon called Wilder Penfield. In the early 1950s, Penfield started stimulating different parts of his patients' brains whilst they were on his operating table. He was practicing then at the Neurological Institute in Montreal, which he established. By noting the motor movements that stimulation of different parts of the cortex evoked, Penfield was able to carefully map which parts of the cortex control which body part. this was a groundbreaking discovery at the time. The result was a map in which some parts of the body were big, like the face and the lips, and others were grossly small comparatively. This disproportionate picture or caricature has been called the homunculus, or the little man. Again, one will have thought, that is it. We have an accurate map of the brain and we know which part of the brain controls which body part. But subsequent discoveries have shown us that the map of the homunculus and any other map of the brain is not a fixed map. Rather, these maps are ever-shifting sketches. According to David Eagleman in his book Live Wired, the first inkling that the cartogram or the maps are fluctuating was provided by a scientist called Edward Taub. Taub studied the motor maps in 17 monkeys after they had some of their nerves severed, and this was in 1981. By some fortuitous pathway, he was able to re-examine these brains in 1990. Comparing the maps of these monkeys in the interval of about a decade, Taub was able to show that the maps had changed significantly between the first time he examined them and the second time. Taub therefore established that the homunculus was not genetically programmed and it is not a fixed map. As Eagleman put it, Taub showed that the brain's map was flexibly defined by active inputs from the body, and when the body changes, the homunculus follows. In explaining why the cortical maps change, Eagleman argued that when a part of the body no longer sends information, it loses territory. Right? That it loses territory in the brain. Explaining that the cartography of the brain constantly shifts to best represent the incoming data, he illustrated this with how the auditory or the hearing cortex of someone who has become deaf can be allocated to subserve vision. He also said this reallocation of brain areas is why perfect musical pitch is overrepresented in people who are blind. And it is also the reason why colorblind people are better at distinguishing between shades of gray. And they are much better at spotting enemy camouflage, much better than people with normal color vision. Eagleman even went further to describe the scenario of a chronic and unforgiving competition for brain real estate. And this is what happens every night when we go to sleep. As the visual cortex would go to sleep, it is at risk of being taken over by other brain areas. To prevent this, it starts this ridiculous dreaming episodes which seem to make no sense, but Eagleman believes it's the visual cortex protecting its territory. A lot to digest and a lot of history in neurology, but we will put that aside for a future episode. In the next episode, we will take a deep dive into the clinical dimension of neurology. And perhaps it is quite right, we start with Alzheimer's disease, the scourge of many and the fear of all. Once we've had a deep dive into Alzheimer's disease, I will be in conversation with Daniel Gibbs, author of the book called A Tattoo on My Brain. I will be discussing his experience of Alzheimer's disease, both as a neurologist who has treated it and as someone who is going through the early stages of the disease. In a way, Daniel Gibbs symbolizes the aim of this podcast. Thank you very much for listening or watching this podcast, in which I tried to link the earliest history of neurology to the most important principle of neurology, localization. I have relied on two main book sources for this podcast. The first is by Andrew Pickens, titled A History of the Brain, From Stone Age Surgery to Modern Neuroscience. This was published in 2015. The second is by Leonard Lapointe. The title is Paul Broca and the Origins of Language in the Brain, and this was published in 2013. I've already referred to David Eagleman's book Live Wired, and this was published in 2020. I've also cited a couple of references, and the first by Zils is titled Brodmann, a Pioneer of Human Brain Mapping, and his impact on cortical organization, published in Brain in 2018. And the second is by Thomas, and that's in a book titled Encyclopedia of the History of Psychological Theories. And this talked about Pierre Flourens. If you found this podcast enlightening, why not consider subscribing to Neuro Checklist, where there is a lot of information about neurology, and you may want to explore the lighter side of neurology in my book called Surfing the Brain. And to make sure you don't miss the next episode of this podcast, why not subscribe either to the iTunes, the Spotify, or the YouTube channels, where we will be talking about Alzheimer's disease, the topic being titled Entanglement, What Alloys Saw. Thank you very much for your time, and do join me then.